Hey guys, welcome back to my page. Today we're going to be doing a 10-minute video on DIASTASIS RECTI, and Sherri is here to do this video with me. So if you guys haven't checked out the video I posted a couple weeks ago, it's on pelvic floor exercises and how to turn on those deep core pelvic floor muscles. The important part about that video is that it's the first step essentially to kind of drawing in those muscles to help treat a diastasis recti. So Sherri here had her daughter how long ago?
6 years ago.
6 years ago. So she has a diastasis recti and hers is old at this point. But what are some of the things you're still feeling from that?
Lower back pain, different rotations are hard, stability-wise.
Yeah, so a typical of some of the symptoms of having a diastasis recti is the lower back pain. And sometimes people feel really tired because your core isn't there to stabilize you as you move throughout your day. So you're working really hard, extra hard than you have to do kind of normal motions. Sherri here is really high level in terms of exercise. She exercises all the time. She was an athlete. So her diastasis recti hasn't stopped her from doing these really hard workouts and being really functional. But she does have a hard time doing some of those core workouts. So she has to kind of take it back to the baseline exercises so that she can work from the inside out, turning on those muscles. So again, if you haven't, I'll link it to this video. Do the other video. It's the first level. You have to be able to do those exercises first so that you know you're turning on those muscles properly before you do this workout. Just because if you skip knowing how to turn on those muscles, then you'll be able to do these exercises, but you probably won't be turning on those muscles correctly. So do that one first, and then now let's get into these 5 exercises. They're gonna be 45 seconds on, 15 off, and I will be helping Sherri go through them. So let's get started. Okay, so I have my timer set here. So the first exercise, so it's gonna start in 15 seconds. The first exercise is called a dead bug. So if you remember in the first video, we're gonna press our back flat to the floor and kind of do this posterior pelvic tilt, okay?
3,
we're flattening,
2, 1.
Tuck the ribs down,
Exercise
good.
1.
Knees up, arms up, and she's gonna go opposite arm, opposite leg. Good. So as she's going through this exercise, the things that you want to think about is that your back is really staying pressed to the ground. So if I try to get my hand under here, I can't get my hand under there because I know her back is flat. So she's turning on that transverse abdominis. She's doing that Kegel. Everything's pulling up and in. You want to try to make sure this is more of a plane versus hills and valleys. So it shouldn't be doing this. It should be relatively flat. Good job, Sherri. And you see how she's keeping her leg up? That's as far as she can go before her back comes up off the ground.
Rest.
Good. So the next one's a bird dog. So come on up, Sherri. So she's going to come on her hands and knees. Same idea as the last exercise. She's going to pull up.
2,
Good.
1. Exercise 2.
And opposite arm, opposite leg. As she does this exercise, she's belly button's staying tucked in. She's tucking her ribs in. Good. And then imagine like you are putting either a stick on your back. The stick should stay even. It shouldn't be kind of wobbling like this. Or sometimes if you're really good at this, I tell patients, you should be able to balance a cup of water on your back. That's how stable your back should be during this exercise. Good job, Sherri. And only lift your arm and leg as high as this stays stable. If you're lifting your leg up really high and your back's going into extension, that's just too
3,
far.
2, 1. Rest.
Okay, so for this next one, we're gonna bring out the chair.
Now,
Sherri's gonna do sit to stand, but a pillow between her knees.
1.
around this height.
Yep,
Exercise 3.
and go ahead. So again, same principles as the other two. We're using the pillow so that we're turning on all these, your adductors, your groin, your pelvic floor, everything's turning, pulling up and in as she's doing this exercise. We'll show you from the other direction for the second round, but the chair is really nice because it cues you properly to do kind of that sit back, butt back position for your squat. And it also allows you to focus a little bit more on turning on those deep muscles. How's it feel, Sherri?
Burns. It feels good.
Yes.
3, 2, 1. Rest.
Nice job. Okay. So these next two, we're gonna use a band. This is called anti-rotation press out. So she's gonna grab the end of this. I'm gonna be her
3,
anchor.
2,
She's gonna be a little bit of a squat. You're just gonna
Exercise
press out. Yeah, there you go. So for this band, if you're doing this by yourself, obviously you don't have somebody to hold it. If you tie a knot, if you just have like one of those elastic rubber bands, if you tie a knot in it and put the knot on the other side of the door and shut the door, then you can put this at any level you want to do this by yourself. So Sherri's keeping everything nice and in. Pelvic floor is coming up, turning on that transverse abdominis. And she's basically resisting the band pulling her to the right. Good job, Sherri.
3, 2, 1. Rest.
Nice. So the next one is anti-rotation walkout. She'll be in the same position. She'll start closer to me.
Just hold it
Yeah,
tight.
she's gonna hold it tight, and then she's gonna walk out to the left and then back to
3,
the right.
2, 1. Exercise 5.
And then the band will give her some resistance. Good. So having your hands close to your chest will be the easiest version of this. Putting your hands further away from your body will give you a lot more of that resistance, right, Sherri?
Come on.
So the whole goal with this one is that everything is moving in one unit. There should be no lag as you step out in terms of like the band trying to pull you. Good job, Sherri.
Oh my goodness.
You're strong.
3, 2, 1. Rest.
Nice job. Okay, so back to the beginning. Back on your back.
Rest.
Oopsies. Okay. Here we go. And
3, 2, 1. Exercise 1.
good. So as Sherri does this one, if this is too hard to do the arms and the legs, you can always just pick one to do, because then you won't have as much kind of going away from the center of your body. It'll be a little bit easier. Or just lower your legs, or put your feet on the ground before you press them
That's
out.
halfway.
Good job, Sherri. This one looks deceivingly easy. It's very, very hard. Right, Sherri?
Yes, shaking. But it's a good heart.
Yeah. Again, check yourself. Are you keeping this nice and pressed to the floor?
3, 2,
Are your ribs tucked
1.
in?
Rest.
Good job. Bird dog. Whoops. I got it. Just remember, belly button to spine, ribs tucked in.
2, 1. Exercise 2.
We're gonna multitask. There we go. I'm gonna pull this up a little bit so they can kind of see the nice, remember, imagine that cup of water is right here and you don't want to spill it. And Sherri also has a really nice form through her back and her neck, so she's not forgetting to turn on those upper back muscles, her neck muscles. This looks really good. Good job, Cher Bear. She's getting a little shake. Again, deceivingly easy.
3, 2,
Good job.
1. Rest.
All right, back to those sit-to-sit. Oh my gosh, we have Ricky. Come here. Oy. All right,
1. Exercise 3.
and there we go. Good. See how she's coming back, sitting her hips back. Nice job. So really, anytime you're having a trouble with doing a squat correctly, having something like a chair to cue you to sit back in that position is an easy thing you could do for yourself to work on that. Remember, adding the pillow means we're turning on some of those interior structures to pull everything up and in. Nice job, Sherri. Belly button, spine, ribs are tucked in.
3, 2, 1. Rest.
Nice. Okay, so the last two is the walkouts. We gotta go from the other side this time. So there you go. I'll switch sides. So this is just the press out. Wait, not yet. We got 6 seconds.
Oh,
You're excited.
don't excite yourself. Rest.
Exercise 3.
There we go. Good. Again, the further out you go with the resistance band, the more resistance you're gonna get. So go at a level that you're still able to maintain this nice, stable position without any wobble, like Sherri. Your shoulders burning?
Just a little bit.
You can go slower if you want to. Yeah, that's fine.
Okay, this way.
Yeah, that looks good. This is a great arm workout, but it's really trying to focus on not letting your
3,
core rotate.
2, 1. Rest.
Nice job. Okay, last one is the walkouts.
3,
Ready?
2, 1. Exercise 4.
Nice job. They're just pulling me over. Good. And remember, for these ones, closer to your hands closer to your body is easier. Further out is going to be more difficult. It's going to add more of that rotational force. And Sherri's mixing it up, which is totally fine. Do whatever you feel like your body can tolerate. Good job, Sherri.
3, 2,
Nice job.
1. Rest.
Nice job. Woo! Good job, Sherri Bear. Okay, so that was 5 exercises, a little bit more functional for the diastasis. Again, do the kind of the first level video first before you do this one. Not that you can't do this one. Everybody can do this workout, but you want to make sure you're turning on those muscles properly first. So thank you, Sherri, for doing this workout with me. She's working on her getting diastasis and getting stronger with that.
6-pack diastasis.
Yes, yes. She's sexy with it and she's strong, so good job, everybody. Come back and we'll do some more of these exercises. Subscribe to my page or like this video and comment on the bottom if you want to see some other stuff, and we'll make the videos you guys want to see. So, all right, guys, bye.